Well, this leads U.S. President Donald Trump has entered a military hospital for treatment after being diagnosed with COVID-19, roughly 17 hours after he announced that he had tested positive for the coronavirus. Trump walked slowly from the White House to a waiting helicopter to be taken to Walter Reed National Military Medical Center in Bethesda, Maryland. He wore a mask and business suit. People gathered outside the fence to watch the helicopter carrying the president touch down at Walter Reed. The 74-year-old president walked down the steps of the helicopter and into a vehicle, riding to a nearby building in the medical facility. The White House says Trump will work in a special suit at the hospital for the next few days as a precautionary measure. The president's illness has severely disrupted his re-election campaign with just 31 days to go until Election Day. He's the latest world leader to test positive for the virus. Others include British Prime Minister Boris Johnson and Brazilian President Jair Bolsonaro. Both men have recovered. And Democratic presidential candidate Joe Biden says President Trump's coronavirus diagnosis is a bracing reminder that the pandemic needs to be taken seriously. Biden was campaigning in the battleground state of Michigan.
I would like to start by acknowledging, which I'm sure all of you do as well, sending my prayers for the health and safety of the First Lady and President of the United States after they tested positive for COVID-19. My wife Jill and I prayed that they'll make a quick and full recovery. This is not a matter of politics. It's a bracing reminder to all of us that we have to take this virus seriously. It's not going away automatically. We have to do our part to be responsible. It means following the science, listening to the experts, washing our hands, social distancing. It means wearing a mask in public, and it means encouraging others to do so as well.
And for more on the hospitalization of the U.S. president, we're joined now by our foreign editor, Sophie Mokoena. Very good morning to you, Sophie. Thanks for joining us. Now, President Donald Trump for months downplayed the impact of the coronavirus, famously saying that the virus would simply go away. What do you think will be his stance on COVID-19 going forward?
Well, I think it was a rude awakening call for President Trump and those around him, particularly his advisors, that COVID-19 is with us, and as long as we don't have vaccine, it is going to be a continued struggle to try and deal with this pandemic. And all of us as human beings, we are vulnerable. It doesn't care whether you are a high-profile politician, an ordinary worker, or the downtrodden. The disease is here to stay as long as there is no virus, and therefore it is up to the leadership around the world to ensure that they lead by example. For example, when you look at the recommendations from the World Health Organization in line with the regulations to combat this pandemic, there are simple issues to follow there, and all of us, if we can follow those three simple regulations, I think we can see a difference. We can be able to contain the virus, for example, just to wash our hands regularly, and also to use sanitizers. If you are not at home, you don't have soap to wash your hands. And of course, washing your hands with soap is the most effective way of cleaning the germs and viruses that might be in your hand. And secondly, safe distance, keeping a safe distance, or perhaps a distance from a person that you are with, almost 2 meters. It is the only way to go. You don't have to keep a social distance. You can keep a safe distance like you normally do when we are driving, so that you don't bump into the person in front of you. You just keep a safe distance, and social distance, it's normally the word we use, but we can continue to emotionally support each other, using technology to communicate, but also to ensure that at all times, we are wearing masks, and we don't have to buy the surgical mask. You can just use a cloth at home, 3 layers, and just use it as a mask, so that you are not transmitting the virus should you have a virus and you are not aware to the next person. And therefore, it is up to us to protect each other with those simple measures. And that's what President Trump failed to do on many occasions. Because when you look at what transpired on Saturday at Rose Garden ceremony outside White House, where he announced the nomination for the Supreme Court vacancy, there were many, many high-profile people there. And there, you know, most of them were not wearing masks. And since the president has been has tested positive, many of those people, as part of contact tracing, are now also testing positive. You don't even know how many people they've met before they knew yesterday that they are positive. And I think it demands a responsible leadership. And truth be told, President Trump was not responsible in terms of statements he uttered previously about this virus. Let's take a listen at what he had to say previously about this coronavirus.
Part of the thing is you want to keep it the way it is. You don't want to see panic because there's no reason to be panicked about. But when I mentioned the flu, I said, actually, I asked the various doctors, I said, is this just like flu? Because people die from the flu. And this is very unusual. And it is a little bit different, but in some ways it's easier and in some ways it's a little bit tougher. But we have it so well under control. I mean, we really have done a very good job. We have done an incredible job. We're going to continue. It's going to disappear. One day it's like a miracle. It will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. Nobody really knows. I like this stuff. I really get it. People are surprised that I understand it. Every one of these doctors said, how do you know so much about this? Maybe I have a natural ability. Maybe I should have done that instead of running for president. Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting.
Get the right folks who could.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me. But I guess I'm doing okay because, to the best of my knowledge, I'm the president of the United States, despite the things that are said. I carry the mask when I have to go. I went into Walter Reed Hospital the other day. I have the mask right here, and I carry it, and I will use it gladly. No problem with it. So it sort of is curious. A man works for us, with us, very closely, Dr. Fauci and Dr. Birx, also highly thought of. And yet they're highly thought of, but nobody likes me. It can only be my personality, that's all.
Well, that's just a collage of U.S. President Donald Trump's former statements about the coronavirus. But we're staying on a conversation with our foreign editor, Sophie Mokoena. Sophie, what is the World Health Organization's reaction to Donald Trump's condition following all that occurred between them?
You are aware that there is tension between the United States of America and the World Health Organization, here the president in particular. And therefore, yesterday, the WHO did comment when they were forced to respond to the latest developments, but they were very careful because they don't want to be seen as perhaps celebrating what is happening right now. But there was a strong message from particularly the executive director, Dr. Mike Ryan, while the director general, Dr. Tedros, was very, very diplomatic in terms of his reaction. Let's take a listen at what the WHO leadership had to say about Donald Trump testing positive for coronavirus.
We wish the president and his partner well, like we would wish anyone facing this disease well. This is a nasty virus, and this virus can cause severe disease, particularly in older individuals with underlying conditions. So we wish the President and his partner well in this process, and anyone else who's affected within that cluster. Disease can be transformative. We've all been through things in our lives, health events that transform our lives whether we want them to or not, and therefore and other things that allow us to learn and absorb lessons from our lives. We want everyone possible in the world. We want all public leaders, particularly leaders of great countries, to lead us and to give us hope, to give us certainty, to give us truth, and to give us a chance to fight and win against this disease. So it is never, ever, ever too late for that to be true. And therefore I hope that all leaders around the world in health, in medicine, in politics reflect upon what we're all facing, and that we can all come together to fight this disease, and particularly to be very practical, to each government to invest enough in its community, in its surveillance, in its clinical care, so we can bear the burden of the disease for now and push the disease to the lowest possible level. But as well, and I say this quite clearly, there is a solution potentially coming down the line. There is huge innovation developing the vaccines, the therapeutics and the diagnostics that we need. There is a barrier between us and that achievement. And it is a relatively small amount of money when we think about what has been spent and what has been drained from our collective pocketbooks from the global economy. Vaccines particularly don't offer an absolute final guarantee of getting this done, but they are a massively important tool, as they've proven themselves to be in the past. So I would say fine words are fine, and we need those words, but what we need now is action. What we need now is investment, and what we need now is solutions. And I hope everybody can reflect right now, as we send our best wishes to the President and his spouse, that we can redouble our efforts, find the right investments and get this job done.
Overnight, we heard that the President of the United States of America, Donald Trump, and First Lady Melania Trump tested positive for COVID-19. I want to start today by wishing them both a full and swift recovery. Our prayers are with them.
Well, those are the World Health Organization responses to the news of U.S. President Donald Trump contracting COVID-19. And this almost wraps up our conversation with our foreign editor, Sophie Mokoena. Sophie, as we look ahead to the new week, what can we expect to see coming out of the U.S. with regard to this story?
I think many journalists around the world will continue to monitor the developments, particularly because the president is still at the military hospital, and therefore every hour people are looking for updates, and we are hoping that later today, Central African time, Shawan Prestes will get us information. He will be able to give us the latest. And secondly, what is important for me, the words of the executive director, Dr. Mike Ryan, saying it's well and good, perhaps after this, for Donald Trump to come out and change his position in terms of weight, but he will be judged by the action. You are aware that he has decided to pull out of the World Health Organization and therefore also cut funding to this important United Nations agency that deals with health issues around the world at the time when the pandemic is ravaging the world. And therefore, I think there he was making a call that America must reconsider the decision to stop funding, but also to invest in a new initiative that has been established called COVAX. COVAX is an initiative to pull resources from around the world, money, to put aside money to fund research and development of vaccine and other perhaps important medicine that can assist us as the world to deal with this. And our President Ramaphosa, is the co-chair of COVAX and Norway. In other words, you now have countries such as Norway and South Africa taking a lead to assist the world to deal with this pandemic. The big guys, US, China, the people who are supposed to take a lead with a lot of money, lots of dollars, are fighting. You know, the two are fighting, and therefore they are making it impossible for the world to have synergy in terms of fighting this pandemic, even though China is also supporting the initiative, but they haven't signed up fully to the initiative. And also when you look at rands and cents or dollars that China is contributing, yes, they are, but it's not so much when you look at what they are generating, and one of the second largest economy around the world. The United States completely looking inward, and now here we are dealing with a crisis where the president of the most powerful country is now dealing with COVID-19, hospitalized at the military hospital, and we'll see what happens going forward. But looking at his age, I think it's going to be a very tough battle. All those suggestions that he had how to deal with COVID-19 when you are infected, he is not using those advice and suggestions now. He's looking science and doctors to help him, the very same scientists and doctors that he has ridiculed previously. And I think all around the world would want to see President Trump winning this battle, because it is important for United States of America to come back and be part of the global village, and all the countries of the world and leaders of the world must take one position to protect the vulnerable who have no say and who are mostly affected, who cannot go to the military hospitals, who cannot go to the private hospitals, who don't have medical schemes, even workers losing their jobs. People are suffering. Poverty is rife. We don't know what we are going to do. The economy has collapsed, and there's no hope unless there's a vaccine.
SABC News foreign editor Sophie Mokoena there, bringing us up to speed in terms of the US president contracting COVID-19, but also with other foreign stories.